is approach to the patient with hemorrhagic disorder or bleeding tendency. الصوت واضح إن شاء الله؟
واضح.
نعم دكتور واضح.
Okay.
نعم دكتور واضح.
Yeah. Now start record. Okay. Before the statement of approach for the patient with bleeding tendency, what is the bleeding tendency? What I mean by the bleeding tendency? The bleeding tendency, it means that the patient have ability to profound continuous bleeding, either spontaneously or after trauma, like after trauma or surgical procedure like tonsillectomy, tooth extraction, polyps removal, or any surgical minor surgical operation. Okay, it is either occur spontaneously or after a trauma. The bleeding tendency, أعيد التعريف مالته, it is the ability of the patient for recurrent bleeding either spontaneously or after trauma or surgical procedure. It could be primary causes or could be secondary causes. When we talk about the bleeding tendency, it is mean hereditary bleeding disorder or a primary bleeding disorder. Our seminar, it will be concentrated about the primary bleeding disorder, not secondary bleeding disorder. ومعظم البرايمري إذا مو كلها فإت is hereditary bleeding disorder. واضح إن شاء الله؟ Okay. عندنا normal body mechanism to the stop bleeding. أنا وأنت any person how the body responds to the bleeding when يصير عندي bleeding. When يصير عندي the first of thing injury or rupture to the blood vessel. Injury or rupture to the blood vessels. راح يصير عندنا vasoconstriction by the smooth muscle of the vascular wall. Vasoconstriction of the smooth muscle of the vascular wall. It will cause vasoconstriction at the site of the lesion to decrease blood flow. After that, there is aggregation of the platelet to the site of the injury to form what we call the platelet block or temporary block for temporary stopping of the bleeding. This platelet block, it will be give time to the release the clotting factor from the platelet and injured blood vessel at the site of the injury to release the clotting factor to release the clotting factor and then to start the clotting cascade to form the fibrin clot, which is regarded as a mesh to stop the bleeding. واضحة الميكانيزم of the bleeding hemostasis؟
واضحة دكتور.
أول مرة يصير عندنا after vascular injury يصير عندنا vasoconstriction due to the contraction of the smooth muscle. After that, aggregation of the platelet to the site of the bleeding and after to form the temporary block, and after that the platelet and the injured blood vessels tissue will be released the clotting factor to form the fibrin clot, which is represent the mesh to prevent the bleeding. What is the clotting casket? Clotting casket or the clotting factor mechanism. عندنا, as you know, extrinsic pathway and intrinsic pathway for the stopping of the bleeding. Intrinsic pathway, that it is mean damage of the blood vessel, while extrinsic pathway, it is in mean damage to the tissue outside the vessel. تعرف الانجري فمو بس injury to the blood vessel, يصير عندك wound أو شيء, وإنما يصير injury to the tissue outside of the vessel, and in addition to the injury to the vessel. So, the intrinsic pathway, it is including cascade of the clotting factor, mainly factor 8, factor 9, factor 11, and factor 12. Then نعتبرها الintrinsic pathway. Factor 8, 9, 11, and 12. Activation of these factors, it will lead to the activation of the factor 10, and then the factor 10 will be converted the prothrombin to the thrombin والثرومبين it will be help to the conversion of the fibrinogen to the fibrin in the final clot. In the presence of the factor 8 it will be result in the blood clot. هذا الانترنسيك pathway اللي هو from the vascular damage activation of the factor sorry هذا مو 7 8 factor 8 أنا sorry factor 8 factor 9 factor 11 and factor 12 factor 12 هذا أول واحد لا factor 8 factor 8 9 11 and 12 بعدين أصلحها زين
دكتور تقدر تشغل المؤشر دكتور؟
وانا مشغل المؤشر هسه
ما في
اوكي هسه
هسه تمام دكتور هسه تمام.
هذا مو فاكتور 12 هذا فاكتور 8 اللي مؤشر عليه هذا فاكتور 8 انا كاتبه 12 سوري
نعم دكتور.
ايه فهنا قلنا الانترنسيك باثواي هو فاكتور 8 فاكتور 9 11 and 12 it will be result in the activation of the factor 10 and activation of the factor 10 will be changed the prothrombin to the thrombin. With the thrombin, it will be changed the fibrinogen to the fibrin اللي هي final clot in the presence of the factor 8. واضحة هاي؟ إن شاء الله. بينما عندنا extrinsic pathway اللي هو قلنا from the damage of the tissue outside of the blood vessel, it will be result in the activation of the factor 2 اللي يسمونه tissue thromboplastin in the presence of calcium and other intrinsic pathway اللي هن factor 2, 5, 7 and 10. Factor 2, 5, 7 and 10. Then the extrinsic pathway. It is also result in the activation of the factor 10. اللي factor 10 والبروثرومبين والثرومبين نسمينها common pathway. اثنين هن يعني الانترنسيك والاكسترنسيك pathway they will be finished in the activation of the factor 10 اللي يسوي activation of the prothrombin to the thrombin والثرومبين يسوي fibrinogen to the fibrin to form the blood clot. واضحة؟
نعم.
أحد عنده سؤال؟
واضح دكتور.
إن شاء الله. اللي عنده سؤال خليه يتفضل. ومثل ما قلت هذا فاكتور 8 وليس فاكتور 12 سوري بالطباعة مالتي غلط. اوكي زين هسه نجي الكوزز اوف برايمري او هيريديتري بليدنج ديس اوردر. اثنين يجينا بليدنج ديس اوردر عندنا اما هيماتولوجيكال كوز او نون هيماتولوجيكال كوز. الهيماتولوجيكال كوز تتقسم الى ثرومبوسايتوبينيا والكوزز اوف ثرومبوسايتوبينيا ذا موست الاي تي بي بالمناسبه شباب الاي تي بي هي due to the presence of the cross antibodies مو صحيح؟ cross antibodies موجودة للviral infection it will be damage to the platelet. فهذا antibodies it is in form of immunoglobulin G which is can't pass the placenta. So the mother when she had ITB the antibodies in her blood can't be passed to the placenta during the pregnancy to the baby فراح يسوي لنا ITB in the neonate. Okay? The ITB مو hereditary but due to the passage of the immunoglobulin G antibodies from the mother to her baby during the pregnancy, it was because transient thrombocytopenia in the neonate. Other neonatal isoimmune thrombocytopenia due to other causes. TAR thrombocytopenia with absent radius. ان شاء الله انا عندي بالسيشنات الجايه سلايدات هوايه راح اراويكم اياها هاي كلها بالسلايدات. التار it is mean thrombocytopenia with absent radius هذا syndrome يتكون من thrombocytopenia of unknown cause with absent of the radius. Wiskett-Aldrich syndrome it is X-linked recessive disorder characterized by eczema, thrombocytopenia and immune deficiency, humoral immune deficiency. فهذا تريد نسميه Wiskett-Aldrich syndrome, X-linked recessive disorder. It is severe lethal syndrome characterized by the severe thrombocytopenia, eczema and immune deficiency. وعندنا Kazabach-Merit syndrome. It is combination of the giant hemangioma or vascular tumor in addition to the consumptional thrombocytopenia and microangiopathic hemolytic anemia. هم 3 شغلات في هذا السندروم اللي هن vascular tumor or large hemangioma in addition to the consumptional thrombocytopenia and microangiopathic hemolytic anemia. These are the causes of neonatal or hereditary thrombocytopenia. عندنا الكواجيلوباثي due to the defect in the clotting factor, عندنا von Willebrand disease, hemophilia A and B, in addition to the platelet function defect اللي هي Bernard Soiler أكيد سامعين بيهن and Klinsmann syndrome. So these are causes of the coagulopathy. أو causes of the bleeding due to the vascular or non-hemorrhagic hematological disorder. Vascular or non-hematological disorder, that means there is a friable blood vessel which can be ruptured easily by minor trauma. مثل ايش؟ Ehlers-Danlos syndrome. Ehlers-Danlos syndrome, it is a deficiency of the collagen, which is leading to the hypermobility of the joints with fragile blood vessels, which is easily ruptured. Telangiectasia and angiodysplasia, also these two conditions characterized by the friable blood vessel, which can be easily ruptured by minor trauma causing bleeding. So these are causes of primary, ما تفرقت السكندري. Secondary بعد هواية causes liver disease, thrombocytopenia, ITB يعني older children, leukemia, and other causes. But we are concentrated on the primary, which is called recurrent bleeding. هي تنقسم hematologic or vascular في الوحدة هذا الكوز. واضح؟
نعم دكتور.
إن شاء الله. رجاء اللي عنده سؤال، اللي عنده نقطة رأسا يقول لنا بها قبل لا نقطة. بس اتهمنا شنو الميكانيزم of the bleeding، يعني to the stop of the bleeding، وعرفنا الكلوتينج كاسكيد شنو الانترنسيك والاكسترنسيك باثواي، وعرفنا الكوزز اوف برايمري او hereditary bleeding disorder. ندخل هسه على الابروتش for the patient with tendons bleeding tendons. انت قاعد بالامرجنسي اوكي واجاك baby with bleeding tendons, severe bleeding, continuous bleeding. يجوا الاهل family, they complain this baby had epistaxis for the last 6 hours. This baby had trauma with injury to the blood vessel and cutaneous bleeding, or to continue. Or the baby had hematuria for the last 3 days, whatever complaint. How you deal with this baby? How you deal with this baby to reach the diagnosis? Any approach, it is started by history. مو صحيح؟ فبالhistory, the first of thing we concentrate about the site or sites of the bleeding. وهسه بعدين أجي لكم شنو importance of the site. تختلف من يصير bleeding مكان عن الثاني. Duration, إيش قد صار للبleeding, and severity of the hemorrhage. How you assess whether it is stop the back or not. It is can be easily stopped or not. بالمناسبة patient with bleeding tendency عادة يصير عنده continuous prolonged bleeding rather than severe bleeding. continuous prolonged bleeding يعني من يصير عنده epistaxis يطول 6 ساعات 7 ساعات، أو من يصير عنده vascular injury إذا bleeding profound continuous bleeding يمكن يستمر 2 3 بينما عادة إحنا إذا أقل 8 دقائق stop bleeding. وهكذا hematuria and other. So the duration it is very important. And severity of the hemorrhage, it is also important. Age of onset, it is important. من ياد عمر بدأ البليدنج، يعني بيبي عمره 10 سنوات 8 سنوات وهسه عنده epistaxis, it is unlikely to be hereditary. مو صحيح؟ بينما لو بادي بعمر سنة، عمر 9 أشهر، عمر الhereditary it is more likely. فال age of onset it is important. Spontaneous bleeding or following a trauma or surgical procedure. And that is very important. If the bleeding occurs spontaneously or after trauma or surgical procedure, the most surgical procedure, it is mucocutaneous procedures. مثل ايش؟ مثل tooth extraction أو tonsillectomy إذا نسوي او بولبس ريموفال اذا مسوي زين، فذني surgical procedure او افتر تروما واقع وهذا صار عنده bleeding او spontaneous. Absence هاي ملاحظة كلش مهمة. Absence of the bleeding after trauma or surgical procedure, it is rule out hereditary bleeding disorder. Absence of trauma bleeding after trauma or surgical procedure, it is rule out the bleeding disorder. Previous personal and family history of same condition, it is very important that baby had the previous history of the same condition, or there is other person in the family, they have a bleeding. It is important because it is both the possibility of the hereditary disorder. History of delayed or slow healing of superficial injuries. هاي important واحد يسأل عليها. ليش؟ لأنه الأم تقول لك دكتور إذا انشدخ أو صار عنده any minor trauma sorry الأم تقول لك دكتور إذا انشدخ أو تخرمش أو minor trauma there is delay in the healing. ليش؟ لأن هنا continuous bleeding و contamination واحتمال يصير secondary infection فتصير delay in the healing of these superficial injuries or wounds. Careful menstrual history in the post-pubertal females. هنا شباب كلش مهمة هاي النقطة وخصوصا if I suspect von Willebrand disease. الفون Willebrand disease تعرفون it is autosomal dominant condition which is affect both sex. Okay, so if the family they have von Willebrand disease, the mild or moderate menorrhagia, it will be regarded as normal in the family. But when it is compared to other families, that it is moderate or mild bleeding disorder. واضحة الفكرة؟ يعني شلون؟ يعني الطفلة بالبوست بيوبرتال من تبدي لها المنسترول سايكل المايه تعتبرها نورمال بالاعتماد على من؟ بالاعتماد على المنسترول سايكل in the family. Her mother, her sisters تعتبرها normal. But when it is compared to other families, it is not normal. It is more severe bleeding disorder. The detailed, careful menstrual history, it is important in the family. And the history of the drug اللي هي interfere with the platelet function, especially aspirin and other non-steroidal anti-inflammatory drug. It is important إذا الطفل ماخذ إذا هو عنده bleeding يعني platelet disorder وطيناه non-steroidal anti-inflammatory drug اعتيادي it will be enhance the bleeding. Lastly, history of the contraceptive pills used by mother. هنا مهمة. Also, if we are suspected von Willebrand disease, نعرف إحنا الفون ويلبراند بروتين it is stressful protein. That means it is increase in the stressful condition. The use of the contraceptive pills تعرفون راح تغير the hormones of the mother. Also in the pregnancy, the same condition, in the pregnancy, the mother, it is a stressful condition for the mother. So the mother will mention that I have mild bleeding, like bruising, epistaxis, menorrhagia, but this bleeding, it will be subside when when I take the contraceptive pills or when I became pregnant. فدي تعطيك كلو بانه هذا الفاميلي عندهم احتمال فون ويلبراند ديزيز. واضحه؟ لما يقول لك كان عندي بليدنج بس مني اصير بريجننت او اخذ الكونتراسبتيف بولز هذا البليدنج يختفي. فمعناها الامايه most likely she had von Willebrand disease or von Willebrand disease protein increase in the stressful condition. Her baby might have von Willebrand disease لأنه autosomal dominant. واضحة نقاط الهيستوري؟
نعم دكتور واضح.
كلش واضح دكتور.
إذا عنده ملاحظة يتفضل. اكو نقطة نسيناها بالهيستوري احد عنده فكرة عليها؟ اوكي. عندنا الفيزيكال اكزامينيشن. صراحة الفيزيكال اكزامينيشن of the patient with a bleeding hereditary bleeding disorder. هو عادة normal. ما عنده أي شيء apart of the presence of the bleeding. But the most important in the physical examination is to determine whether it is mucocutaneous bleeding. من نقصد mucocutaneous bleeding يعني أي شيء طالع من السكين أو من الميوكوزا مثل بيتيكياي، إيكوموسيس، إبستاكسيس، هيماتوريا، مالينا، هيماتاميسيس، هيموبتيسيس، منوريجيا، لأن كلهن يعتبرن mucocutaneous bleeding. أو الطفل لا عنده deep bleeding اللي هي هيماثيروسيس or deep muscle hematoma. ليش شنو الimportant of this to determine? It is depend on the defect in the bleeding cascade. عندنا احنا قلنا mechanism of the stop bleeding هو اول وحده vasoconstriction، ثاني وحده platelet adhesion to the blood vessel، وثالث وحده هي activation of the clotting factor. مو صحيح؟ مساعد الستيبس اللي اخذناها. ف if the patient has defect in the platelet function or number or defect in the platelet blood vessel interaction, they have mostly mucocutaneous bleeding. But the patient with clotting factor defect, they have deep bleeding in addition to the exaggeration of the mucocutaneous bleeding. The site of the bleeding, it will be give a clue about the cause of the bleeding. There are only mucocutaneous, يعني skin, epistaxis, hematemesis, melena, hemoptysis, menorrhagia, hematuria, but it is mean mostly due to the platelet defect or platelet blood vessel interaction defect. أما إذا كان deep bleeding with exaggeration of the mucocutaneous bleeding, it is more severe mucocutaneous bleeding, it is mostly due to the clotting factor defect. This is mostly but not a rule. مو ثابتة. Mostly not a rule. فهذا important to determine whether it is site determine the site of the lesion or the bleeding. Examination may be normal in mild vulnerable gland disease or other mild bleeding disorder. ونقطة كلش مهمة presence of organomegaly or palpable lymph node. It is rule out hereditary bleeding disorder. إذا لقيت عدة patient lymphadenopathy أو organomegaly, it is rule out hereditary bleeding disorder. Sorry, just a second and we'll return back. So, هنا نقطة كلش مهمة presence of the organomegaly or lymphadenopathy, it is rule out hereditary bleeding disorder. هذا فيما يخص الهيستوري والاكزامينيشن. فبالاكزامينيشن يعني الجوب مالتك your job it is to determine the bleeding whether it is mucocutaneous or deep bleeding because it will be give idea about the cause of the bleeding or to rule out to sure if there is lymphadenopathy or organomegaly. Investigations. هنا عندنا the cornerstone for the diagnosis. عندنا بالinvestigation the first of things screening test اللي هن نسويهن to all patients with bleeding. أي واحد يجينا with bleeding نسوي له the screening test اللي هن include complete blood count, bleeding time, activated partial thromboplastin time, والبروثرومبين time. كل واحد يجينا نسوي له السكرينينج complete bleeding time, activated partial thromboplastin time and prothrombin time البي تي. If you cannot reach to the cause of the bleeding by these 4 investigations, then we will go to second line investigations اللي هي تتكون من thrombin time and von Willebrand disease testing. These are the investigation. وهسه ان شاء الله راح ندخل بالتفصيل على كل وحده شنو شغلها، شنو النورمال. كلش مهم ينحفظ النورمال مال these investigations رجاء، لان حتى من تجيك الكيس راح يعطيك بس ارقام، ما يقول لك ايش قد النورمال. اوكي؟ فهنا راح نشوف كل وحده بالتفصيل شنو فائدتها. البليدنج تايم. Bleeding time, it is assess the platelet function or platelet blood vessel interaction. بالمناسبة شباب، من ساعة من حكيت على الكوزز قلت hematological and non-hematological، مو صحيح؟ النون هيماتولوجيكال حطيت اهلر-دانلر سندروم وحطيت الانجكتيزيا وحطيت الانجيوديسبليزيا. ذن كلهن يصير بيهن الانفستيجيشن نورمال، يعني يتغير بيهن لا البي تي ولا البي تي تي ولا الكومبليت، كل شيء ما احتمال بس البليدنج تايم شويه برولونج او موستلي اتس نورمال. اوكي؟ بعدين ما يصير بين، بس هنا then يصير اذا كان هيماتولوجيكال كوز. فالبليدنج تايم it is assess the platelet function، يعني platelet number and platelet function aggregation and then adherence to the blood vessel. فما يقيس لنا اي شيء ثاني. normal value مالته هي 4 to 8 minutes. اكو كتب تقول 3 to 10 minutes، يعني ماكو فرق. 4 to 8 minutes. It is prolonged in thrombocytopenia, platelet dysfunction and von Willebrand disease. نقطة راس السطر، ما تصير بعد prolongation بأي condition. واضح؟
نعم.
هاي نقطة كلش مهمة. Bleeding time it is prolonged only in the thrombocytopenia, platelet dysfunction or what we call thrombocythemia and von Willebrand disease. ليش von Willebrand disease prolonged بيه؟ لأن ليش؟ إذا احنا قلنا هو it is assess the platelet، فالفون Willebrand ليش تصير بيه prolongation bleeding time؟ أحد عنده فكرة؟
لأن الفون Willebrand هم مسؤول عن البليتلت يعني فانكشن.
Excellent. الفون Willebrand protein it is stimulate the migration of the platelet to the site of the bleeding. So it is important. هو والفون Willebrand deficiency it is also related to the factor 8. فالفاكتور 8 يساعد من يصير فون Willebrand deficiency يصير عندي deficiency of the factor 8. لذلك البيشنت with von Willebrand disease يصير عنده prolongation of the bleeding time لأنه it is important for the platelet function. فالفائدة مالت bleeding time يأسس platelet function. الفاليو 4 to 8 minutes و it is prolonged in 3 conditions هي thrombocytopenia, platelet dysfunction and von Willebrand disease. إذا أي patient أول ما استلمه عنده bleeding أسوي له bleeding time. إذا طلع عندي prolonged أروح على platelet. إذا طلع عندي normal أروح على clotting factor. شفت شلون؟ قسم لي إياها من البداية من نصين. الكومبليت طبعا هو اللي يهمني به هو البليتلت. الهيموجلوبين ليفل it is reduced in chronic or recurrent bleeding. والبليتلت كاونت البليتلت كاونت تعرفون النورمال هو 150 to 450,000 per cubic millimeter. الكاونت if it is less than 100,000 it causes prolongation of the bleeding time only without bleeding. إذا count more than 50,000 per cubic millimeter, it is rarely associated with significant bleeding. If that count more than 50,000, it is rarely associated with significant bleeding. Or if the count less than 20,000 per cubic millimeter, it is associated with spontaneous bleeding. platelet normal 150 إلى 450 ألف. Count if it is less than 100, it is only cause prolongation of the bleeding time. Count less than 50,000, it is rarely associated with significant bleeding. And if it is less than 20,000, it is associated with spontaneous bleeding. So if the patient has prolonged bleeding time, I will do the platelet number, platelet count. If I get a thrombocytopenia, I will search for the cause of the thrombocytopenia. If it is normal count, I will assess the platelet function to rule out thrombocytopenia. Then, if it is good platelet function, I will do platelet von Willebrand assay. واضحة؟
نعم دكتور.
إذا طلعت عندي لا البليدنج تايم it is normal أروح for the assessment of the clotting factor function. A clotting factor function, it is by the two, either activated partial thromboplastin or by the prothrombin time. Activated partial thromboplastin time اللي نرمز له اختصارا APPT. Normal value it is 25 to 40 seconds. Varies with different lab طبعا according to the kit used by the lab in the beyond neonatal period and up to 70 seconds in the term neonate. Normal, the neonate term neonate is about 70 seconds and in the beyond neonatal period it is 25 to 40 seconds. لذلك أي ورقة هسه من نشوفها مالت ال BTT حاط لك الكنترول مالت المختبر depending on the kit. يعني إذا الكنترول مالته فرضاً 30 فإذا it is more than 30 it is indicate prolongation.
دكتور الوقت خلص، نضطر انهي ونبلش ميتنج جديد.
يلا اوكي
تمام.